Hello everyone. All February we've been celebrating Valentine's Day and all the good things that come to heart. And today I get together with my dear friend, Dr. Deborah Kelly, a partner at Piedmont Internal Medicine, to talk about a very important initiative that it's become kind of a tradition, get together and talk about every year. February is recognized by American Heart Association as American Heart Month, and therefore I am so honored that you're here and talk a little bit about not just female hearts, but generally your patients' cardiovascular disease awareness and workup. Welcome.
Well, thank you for having me back again. It's always a pleasure.
I'm so glad.
So heart disease is the #1 cause of morbidity and mortality in the U.S. for both men and women, and it's certainly advisable to get an evaluation with your physician and go through risk factors, both modifiable and non-modifiable risk factors. So you need to assess the patient and come in for a physical, and the #1 reasons of heart disease increased risk is high blood pressure, high cholesterol, diabetes, kidney disease, renal failure, sedentary lifestyle, obesity, lack of exercise. So these are all modifiable factors that we can work on. Also, gender is a risk factor for men, and again, family history. So we assess the patients and their risk factors and recommend cardiac screening, which would be including cholesterol checks, diabetes checks, kidney disease, and get CT calcium scores to screen for plaque.
I think that's so important. And is that done during a routine annual visit when one of your providers or you sit down with the patient, or should we be looking for, if we have kind of a self-awareness of the factors, come a little bit more frequently than once a year?
Definitely once a year over 40 should be done. And if something is found like hypercholesterolemia and you need to be on medications, that needs to be monitored every 6 months. Or if you have high blood pressure, that needs to be monitored every 6 months, or if it's uncontrolled, every 2 to 3 months. So it just depends on what is found in your physical examination as to the frequency.
And I think this is so important because as our understanding continues to grow, what feeds into these risk factors, I know that in our offices, we see almost a new generation of patients, and you and I have talked about this as well, how differently we now approach treatment of obesity. So let's talk a little bit about that, because as we'll kind of dive into it a little bit deeper, I think that from both internal medicine and dermatology, this congruence of approach can be very beneficial. Do you see patients of all ages that are beginning to start thinking about the medical weight loss journey?
Well, absolutely, and it's very important for cardiac health, also for diabetes, cholesterol, blood pressure. All those are affected by obesity. So losing the weight, a lot of times we can peel off medications if they are obese with a BMI over 30 and they get down to 25, we can often take down a lot of the medications. So it's very important, and following a Mediterranean diet, which is an anti-inflammatory diet in conjunction. So you need to focus on higher protein and veggies and lower in the white things is what I tell patients, because they understand that. That's bread, it's crackers, rice, pasta, dessert, wine. So keeping those low and sticking with the Mediterranean diet is what is recommended for obesity. But of course, in conjunction, I'm sure a lot of patients have seen or used the GLP-1 agonists, which have been actually shown, as we've learned more and had more experience over a few years, that it really decreases cardiovascular risk, because the point is lose the weight. And so losing the weight, all of these other things get better. And so the cardiologists, we're finding them wanting to have us put the patients on those medications. And you have the semaglutide and you have the tirzepatide. So there are 2 different classes that you can pursue, and they really are remarkably beneficial to the patients. Yeah, we're also seeing even like the gastroenterologists are wanting patients on it too, because fatty liver is getting better with, again, losing the 30 or 40 pounds that need to be lost.
I mean, I'm very excited. I think the reports are coming from different specialties. You know, I know the neurology is talking about there may be long-term benefits, as Alzheimer's and so forth. So really exciting news about these medications. And I think that as we focus this month on healthy heart, I think particularly pertaining to the general wellness, I think it's such a great beginning of the journey. From our perspective, we're beginning to understand what these medications do, not just to weight loss, but changes that are created in the deep dermal fat and the brown fat, and how we can participate in the journey, meaning starting earlier, and this is when we talk to our patients about biostimulation, either with topicals or injectables, for example, like Sculptra, or different devices that we employ in treatment. Pure Impact that uses magnetic resonance. We are using Softwave that uses ultrasound. Radio frequency can be very beneficial. So it's all very much based on patient-dependent basis. But as the journey begins is when we ask to be kind of incorporated in the journey, because it appears that the earlier that started, the better it is. But I think that that's very exciting news for the Healthy Heart Month.
Absolutely, and patients need to exercise. They want us moving. They need to exercise cardio 150 minutes per week, so that can break down to 30 minutes 5 times a week, in addition to 2 days of resistance training to maintain the muscle, like we're talking about maintaining the muscle, that these other stimulations can help. And as we get older in age, it also helps maintain balance control, so we need to lift weights 2 days a week.
Yeah, and I think that that's all so important. I think that fortunately, we're now just thinking in isolated little groups of when we think about wellness, when we think about health. I mean, I think that the collaboration really becomes so important, that patients know that this kind of, somewhat of a holistic, in a sense of looking at a patient as a whole person, is very, very important. Well, I am excited for both of us that this 2025 glow up continues, and be healthy, keep your heart healthy, listen to Dr. Kelly, exercise, eat right, do all of the right things, and then come see us so we can help along with the journey. And the healthy journey is the right one for 2025. Thank you so much for being here.
Thank you for having me. Thank you.